Hello, how are you doing today? We want to talk about surgical safety checklists by WHO. It is a standardized tool that WHO brought out to be used in the theater to improve the patient safety, reduce errors, and enhance communication among the team members. What is this tool all about? Remember, it is not just a paper as I'm holding it. It's actually a life-saving tool, all geared towards the patient safety. It has three parts. The first part is written before induction of anesthesia. That means we have to do this before patient is under anesthesia to show you that it has to be when the patient is still awake. So then after that, before skin incision, then before the patient leaves the operating room. So let's go. Before induction of anesthesia, this will be done with a nurse and an anesthetist. The first question is, has the patient confirmed his or her identity, the site, procedure, and the consent? So the patient has to confirm that that's the patient you're actually talking about. Are you Mr. A or are you Mr. B? The patient should be able to answer by saying, I'm Mr. A, and this is my surname and date of birth. What of the sites for the procedure? The patient should be able to say that. And the procedure that is going to be carried out on the patient, you say, do you know the type of procedure that is going to be carried out on you? The patient will be able to answer. Then you ensure that patient has given his consent. The next one is the site marked. Yes is the first one. The other one is not applicable. You know, any body part that has two, maybe right hand, right leg, left, any body part that has two has to be marked so that you are sure you are going to operate on that body part to avoid any mistakes. Then checks. Is the anesthesia machine and medication check complete? This is preparation by the anesthetist, whether their machine is functioning, whether all their drugs are in order. All these geared towards safe surgery. Is the pulse oximeter on the patient and functioning? This has also to be in place. Then the anesthetist will now have to answer whether the patients have any known allergy. Did you understand? Does the patient have a known allergy? That question has to be answered. All this are to make sure that the patient is not going to react to anything in the theater for safety. Is there any difficult airway or aspiration risk? If there's any difficult airway, then you know that whether there is any need for any other assistance. Then, is there risk of more than 500 ml blood loss in children, 7 ml per kg in children? If it is no, well, if it's yes, then you know that there has to be 2 IV access. So all this we do before patient is put under anesthesia. Then before skin incision, the nurse has to be there, the anesthetist and the surgeon. Confirm all team members have introduced themselves by name and the role. So all the team members, the surgeon, the assistant surgeon, the periop nurse, both the circulating nurse and the scrub nurse, the anesthetist, all the team members, they have to introduce themselves by name and the role. Then the surgeon would now have to confirm the patient's name again, the procedure he is going to do, and where the incision will be made. Then you now continue asking, has antibiotic prophylaxis been given within the last 60 minutes? So this antibiotic prophylaxis is also to prevent infection on the patients. Then is there any anticipated critical events? You ask the surgeon, what are the critical or non-critical steps? The surgeon will answer, how long will the case take? What is the anticipated blood loss? So you want to know so that they will now have to prepare for blood transfusion. Then to the anesthetist, are there any specific patient consent? So if there's any consent, the anesthetist will tell you, maybe the patient is at risk of maybe is it aspiration or is at risk of hypoglycemia. If there's any consent, they will now tell you. So the nursing team, they will be asked, has sterility including indicator result been confirmed? So the nursing team has to be sure that all instruments that are going to be used on the patient, they are sterile. So they will now answer, is there any equipment issues? If there's any equipment issue, it must have been rectified before this particular surgery. So it's essential imaging displayed. So do they need if there's an X-ray or anything, X-ray viewer, do they need it? If there's any, they will now answer. So after the surgery, before the patient leaves the operating room, with the nurse and anesthetist and surgeon, the nurse will now confirm the name of the procedure, completion of instrument, sponge, and needle counts, because the nurses always count their swab and instruments to prevent forgetting anything inside the patient's abdomen, thereby causing a lot of harm on the patient. Specimen labeling, read specimen labels aloud, including patient's name. So we ensure that every specimen is well labeled and histology form in field, whether there are any equipment problems to be addressed. So in the course of the surgery, did any equipment give them issues? It has to be addressed. So to surgeon, anesthetist, and the nurse, what are the key concerns for recovery and management of these patients? The anesthetist will answer and the surgeon will now answer, so that everybody will be braced up for the challenges ahead. So you can see that what I'm holding is not just a paper. It is an important tool for the care and the safety of the patients, enhances good communication, and prevents error during a surgery. Thank you.